Hi everyone, I'm John Salzman. This is the lightning summary for the Psychosocial Needs Talk as part of the AYAO Power Series. We know that AYAs with cancer experience multiple significant disruptions in many aspects of their lives. Depression, anxiety, and loneliness can be common experiences both during and after treatment. 1 in 4 AYAs are affected by depression. 1 in 3 experience psychological distress or anxiety, including fear of cancer recurrence. 1 in 2 report feeling lonely. These experiences are disproportionately greater for those AYAs who are female, who are marginalized or minoritized, such as members of the LGBT plus community, AYAs who are racial or ethnic minorities, including Black and African American AYAs and Hispanic and Latinx AYAs. Also, it's more common among AYAs who are treated in adult centers compared to pediatric centers. So these symptoms can manifest themselves across 3 qualitative dimensions. 1, the level of disruption. So do these symptoms interfere with quality of life? 2 is what's the duration of those symptoms? Has it been going on for days, weeks, or even months? And 3 is there discontrol involved? Can patients stop it? Or are these things like intrusive cyclical thoughts around fear of recurrence that they can't disrupt? To tease apart these distinctions, it's important to have a really good screening, assessment, and referral process using valid, reliable, and responsive measures. The PROMIS AYA Health Status Profile is one that I strongly recommend. It's multiple domains including depression, anxiety, physical function, fatigue, pain interference and intensity, cognitive function, and emotional support. 29 items, minimal response burden on participants without sacrificing measurement precision. I'd recommend administering at baseline or diagnosis, and then subsequent times at interim disease evaluation, at the end of treatment, and then annually in the post-treatment survivorship phase. For patients that are on treatment, the AYA Health Status Profile can be supplemented with items from the PRO CTCAE or the PEDS PRO CTCAE that tease apart some of the adverse events experienced secondary to treatment. 2 other measurement tools that are worth considering depending upon the needs of your clinic or your setting would be the AYA Post, the Psycho-Oncology Screening Tool, and the NASB, or the Needs Assessment Service Bridge. And there's links to these 2 measures, as well as some of the other things that I'm highlighting on the reference page. So AYAs have multiple needs, which means it's important to leverage your multidisciplinary team, including local, regional, and national AYA community-based partners. There's a number of phenomenal AYA nonprofits that do just great work and provide free services to support the psychosocial needs of AYAs. Don't hesitate to include them in the referral process when appropriate. And lastly, despite the fact that AYAs are at risk for adverse psychological events, clinically significant disruption, they also have an enormous capacity for resilience, where they harness individual, community, and existential resources to sustain well-being in the face of adversity. It can really be quite inspiring, and there's evidence-based interventions that exist to support AYAs to foster greater resilience and to reduce these adverse mental and social health outcomes. They're worth checking out, and I provided a link to a narrative review in the references. Ultimately, we hope to help AYAs and their families live richer, fuller lives. So thank you for listening, and feel free to reach out with any comments or questions.